Greetings, Schaefer Drewes, clinical social worker. I'm licensed in Maryland, DC, and Virginia, and I'm here to share about how to use the therapeutic power to play therapy in sessions. As a registered play therapist supervisor, I have been using play therapy in my practice for many years, and I'm passionate about helping mental health clinicians using play therapy interventions and tools, Sandtray. And so the Therapeutic Powers of Play was created by Dr. Charles Schaefer. He created this way of looking and being as clinicians in the play therapy room that really expands upon many areas. One of the main areas I'll be talking about is that there's 20 core agents of change. Dr. Charles Schaefer, who is one of the co-founders of the Association for Play Therapy, came up with the therapeutic powers in 1993, and since then it has been expanded upon through clinical experience and research, and to now include these 20 core agents of change. Dr. Charles Schaefer and Schaefer Drewes wrote a book, The Therapeutic Power to Play, 20 Core Agents of Change. It's a really great book, and it helps you to even really dive deeper into the 20 core agents of change, looks at it from, there's different authors that have co-authored in this book, so it's a book I really recommend that you get so you can really kind of get this information into your work and really use it, because it's not, these 20 core agents of change are not theories. Instead, there are actions. There are ways of being a superhero play therapist in the room with clients when you're aware of how to really engage clients in using the either directive or indirective play therapy interventions. So the first one, and I think this is the one that is the foundation of the therapeutic power to play, is the therapeutic relationship that the clinician and the client have together, that it's engaging, it's positive, that it looks at safety, attachment, connection, and that the client begins to be able to build this professional relationship with the therapist who is there being mindful, being playful, engaging, imaginative, right with the client, and the client can really feel seen and heard. The next agent of change is self-expression, and this is a part of communication that allows for emotional release, mastery of understanding and our own thoughts and feelings internally, gaining understanding of our world experiences, which for our clients is their family, their community, their school, and also therapy. So this gives a place that a client can use play as a natural language that doesn't require them to use words. So self-expression can be client using movement, body language, singing, noise, dancing. It's so many different ways that a client can really be creative when there's a space that a client can be invited and joined to do that. And then the next is directive teaching. And this is where, as a clinician, you have created activity, having a client play a game with you, something that you've created to directively use for teaching and understanding, problem solving, allowing a client to look at it from a different perspective. So you may be using a game, having a client do a directive Sandtray, where you may say, share with me something that has made you sad this week. So as a clinician, you are using your therapeutic powers to really engage a client in some learning that they can take with them and use in different areas of their life. And then next is indirect teaching. And this would be an approach of child-centered, where we're allowing the client to lead, but there's teaching that's going on in the way that we are being reflective and how we're tracking and noticing what the client is doing versus what they're saying. This involves metaphors, imagination, creativity, and for the client, this may be a way for them to, for the first time, to have someone notice what they're seeing and what they're doing in a way that isn't asking them to tell me what you're doing, instead show me. And then next is the catharsis, which is around healing and releasing emotions in a way that for clients maybe we have many various ways of expressing our feelings. for some clients, they may have big feelings and small feelings, and allowing them to have ways of releasing that through deep breathing, through movement, through drumming, through sand tray, using sensory items that can really be very helpful for clients that may be dysregulated in the session. And knowing that when we figure ways that we can respond to our body internally, it helps us to respond to things in a different way externally. And then next is attachment. And this is around the development of that therapeutic relationship through growing a relationship of connection, safety, felt safety, trust, understanding, eye contact, touch. And for clients, they often create a relationship. This professional relationship is very personal to them. I've had clients say, can you come home with me? Or can I come home with you? Or I love you. Clients who want to give you a hug, and being able to respond in a authentic way. So when a client says, I love you, I will say, I care about you. I'm so excited when you're to see you. Giving a client an air high five, really in response to that connection that we know is really around how we connect as humans, that we are wired for connection. The next core agent is positive emotions. Clients being able to have a variety of various emotions within a session, being able to be silly, being able to have fun and have laughter. But also, this is where this is so important, that the therapist is able to do the same. And I call this being able to get down and dirty in a session, being able to be on the floor, being able to roll around, make mistakes, laugh, be humorous within the session is a great tool for using this core agent with clients. And then the next core agency is resiliency. And often the thought is, are we born with resiliency, or is it something that we learn? And I think it's both. And that clients, when they are able to figure out something that was difficult, a difficult thought, a difficult situation, and they are able to overcome it. So as progress is being made in therapy, you're able to notice and note and say, wow, this used to be really hard for you. Or before, when you came in, you would talk about how when you got angry that you used to yell. Now you're realizing that you're to be able to take a deep breath and take a break. So that clients can use resiliency as a way of responding to personal crises, handling situations, and be able to bounce back stronger in a different way, wiser, and more feeling able to feel more confident and secure about how they're able to manage things. And then the next core agent is countercondition fears. And this is where in sessions, clients may often are going to role play, be creative, imagination, make believe. But it helps clients to, in this condition of fear, is maybe something that has worried them, something that they are afraid of. So we're giving them many ways of being able to respond to that fear in a safe environment, using the dolls, puppets, crayons, Legos that will allow them to help them to decrease their frustration level. But often may happen is their window of tolerance during a session may get to a place where they're really have a difficult time being able to listen, respond, and that's where maybe limit settings come in. But as limit settings, you want to also be thoughtful about how you're using that limit setting, but also giving a client a tool. Using grounding activity, deep breathing can be really helpful. And then next core agent is stress inoculation. Stress is part of life. It's something that's very normal, very much healthy, that we need. It's how we respond to it. So this involves a therapist practicing with client, giving them coping skills, helping them to manage their stress, be aware of their stress, do deep breathing, helping them to be aware of their whole body, doing body scans, deep breathing, relaxation, so that clients can really be aware of what they're responding to. So the therapist is maybe a directive approach of helping clients in responsive to ways that they can release and respond to that stress in a healthy way. Next is stress management. And where this often may show up in sessions is when the session begins to end. And when you are ending a play therapy session, you give a client, as you may in using other therapies and techniques, but giving a client a warning, letting them know there's 15 minutes left, there's 10 minutes left, there's 5 minutes left, so that as the time ends, the client is beginning to be aware of session ending. Doesn't mean there might still be angry, worried, sad that the session's over, but you're helping them to practice and managing. You're reminding them that they'll be back for the next session. You're reassuring them. You're practicing with them. Let's take a deep breath in together. Let's take a deep breath out. So reassuring, using eye contact and body language to really help the client to respond to that. And next is access to the unconsciousness. Often clients are going to be having thoughts and feelings. They may be wanted or unwanted emotions and feelings. And they often will be things that they're not going to verbally say. Instead, asking a client, instead of tell me what you're thinking or feeling, show me, draw it, write it, sing it, create a poem. So in the playroom, giving them access to different ways that they can heal. As humans, we are all learners different. We learn differently. Some of us are kinesthetic, some of us are visual, auditory, visual. So giving clients access to different ways that they can respond to their thoughts and feelings that are the unconscious, the thoughts that they're not able to really talk about. Client who has experienced trauma, sexual abuse, neglect may not be at a space where they can share what's happened because they don't have the words for it yet, but they may know, they have a feeling, and we can give them ways to respond to that. And next core agent is application. And this is helping clients to recreate, re-experience, relearn, redo. And this may happen at various stages within treatment. And that when a client has a new way of thinking about a situation, looking at a situation, they can respond to it differently. And the next core agent is social competence. This is where we're helping clients with social skills, through role play, through cooperation, through mutual fun. And that this may be for clients that those social skills may be positive and negative social skills that they are using. And I think too, as humans, we operate from survival. We do what we know, and we do what we think will keep us safe. But also, there's research that talks about the culture of childhood, that children are going to learn and have various different expectations and values, their spirituality, their religion, what they learn at home, what's accepted and unaccepted. And as the clinician, it's important for us to honor their values and their roles and realize that they may be very different values than our own personal values, but that we respect and we understand, and we help families and our clients to kind of figure out ways that they can respond to different things, but we're making sure that we're being respectful, that we are not the experts of our clients' ethnicity, values, but that we are here to listen more. We're here to support, and where there's change that needs to be, we're there to be there for that as well. And then next is empathy. This is that action of understanding, being aware of, sensitive to, and experiencing and realizing, kind of putting ourselves in another person's shoes. And often for our clients, it's important that we may not have experienced something, a tragedy, a loss, losing something, but we are able to have the understanding and the mindfulness of knowing that the client is experiencing something that may be very painful, that may be very hard, and that we're there to listen. We're there to be understanding, empathetic, and reflective in our response to how we're helping them. And by using in play, when a client is becoming tearful, we're maybe sitting closer to them. We're maybe letting them know, I'm here for you. I hear you. I see you. So it's a way of really helping us in a professional role to be able to say, we may not fully understand, but we're there to listen and support. And then next is self-esteem, in that we're helping clients to have a good sense of of how they feel about themselves inside and how they feel about themselves on the outside. So we're giving clients high fives and good job and you did that and I know you can do it and encouraging them, but we're also allowing them to be in this journey in a way that's going to be helpful for them. So we're not just jumping in to always help. We're waiting to see what they need instead of always offering to do it for them. Often for our clients, they have so little areas in their life where they make decisions. They don't get to decide where they go to school, what they get to have for dinner, where they live, that we want to give them those opportunities of empowerment, of making their own self-determination about what they're thinking and how they're feeling. And then creative problem solving. This is when we're allowing clients to figure out how to solve a problem, that we're there hip to hip, we're there to support them, we're in the room with them, but we're letting them figure it out. And it may where clients have frustration or they say, I can't do this, or my drawing isn't good, that we're there to kind of encourage them along, but it's not that we're there to be the fixers. We're there to be the healers. And then moral development. This core agent looks at in our society, from a societal view of right and wrong. In this role that we are with our clinician, with our clients, as a clinician, we are in a professional role, and that we need to have our boundaries, our ethics, so that when something occurs that that's not safe, when a client tells us something about someone hurting them or something that's unsafe, that we are morally, that we know that we need to make sure that we've let our clients know about confidentiality and privacy. But that in the playroom, we're also there to set limits. So when a client is being unsafe, is doing something unsafe to themselves or to others or to the clinician, that we set a limit. That doesn't mean place ends or the session ends, but that we're setting an expectation so that the client knows what they can and what they cannot do. I very infrequently say no, but when I do, it's around safety. It's around helping the client to maybe figure out how to make a different decision. And you want to look at this from a developmental point of where the client is developmentally. Clients may be one age chronologically, and they may be a different age emotionally. Then around self-regulation. In a play therapy session, clients are going to be able to have access to move and go from one toy, one activity to the next. And so this may really get clients to be either very easily engaged and excited and moving, or some clients may come in and start the session very quiet and calm, and then they might work into, as the session goes on, to becoming more engaged and excited. And also we're wanting to be aware of knowing our client's window of tolerance. When clients have gotten to a point, that window of tolerance, when they're kind of at a place where they're having difficulty listening, difficulty engaging, maybe they're being unsafe, breaking things, that we want, again, using our setting limits, changing our voice tone, leaning in, finding ways within to help the client to better respond. One of the things that oftentimes the thought is that a client can easily regulate themselves when they are either upset, angry, excited. We know that they need some ways of responding to it to kind of respond in a different way. And with self-regulation, it fosters growth of physical and emotional regulation. And it really looks at helping clients to look at their behavior, for clinicians to look at the behavior, but first to look at where the emotion is that's driving the behavior. Oftentimes there is the figuring that out can be helpful to then find a way to best respond to the client's behavior. And then our last core agent is accelerated psychological development. And this is where, as a clinician, we're helping using play to promote growth, change, social, emotional, and neurological development. Where some clients you're looking at to see what areas are they showing growth in, what areas are they maybe showing regression in throughout the course of treatment. But you're wanting to meet the child where they are. And that may be, when we think of clients, that's children ages anywhere from 3 to 18, that's working with individuals, families, and groups. Well, I hope this has been helpful, and please leave a comment. I'll also leave my website where you can look and check out my upcoming live webinars, and also check out my non-recorded webinars as well. All right, be well, play well. Bye.